Hello, everybody. Like she said, my name is Robert Showalter. I'm a registered polysomnograph technologist at the Sleep Center. It's great to be here. Thanks for coming. There's a little sleepiness scale there that I put on kind of by your places there to eat. If you just fill that out, and we'll kind of go over that at the very end. So that's kind of a standard form that sleep labs use across the nation and the world. So that's one of many, but that's kind of a pre-sleep questionnaire. So the topic is sleep is healing, and I'm going to go over just, first of all, I'm going to show you a picture of our sleep center. Of course, we're over at the new MD360. We're on the side of it that kind of faces Walmart, and this is a picture of our comfortable sleep room. We have 4 over there, so we kind of made it as comfortable as we can for the patients to come in and have a sleep test done. These are probably the most common sleep disorders that we see at the Sleep Center. There are many more in the world, but this is the majority of what we see at the Sleep Center. The first one is sleep apnea. It happens because the muscles in your throat relax. It blocks the flow of your air to your lungs. Your airway might be completely blocked or only partially blocked when you stop breathing. The amount of oxygen drops in your blood, and your brain recognizes this and makes your body start reacting to this, it's called an arousal. So then the patient or the person kind of wakes up a little bit and kind of stays in a lighter sleep. It's estimated that 22 million Americans suffer from sleep apnea, with 80% of the cases of moderate and severe obstructive sleep apnea undiagnosed. Some say that it's a silent killer, affecting pulmonary function, speeding up chances of stroke and heart attack. The second one is insomnia. Well, let's look at narcolepsy and restless leg syndrome. We already talked about that. Here's a picture of sleep apnea, and as you can see right here from this picture, to the left is normal breathing, and to the right, you can see the soft palate in the back of your throat begins to close, obstructing the airway. Next one is insomnia. Some of you may have experienced insomnia. Roughly 60 million Americans are affected by some kind of sleep disorder. Insomnia is one of them. Insomnia is experienced with long periods of wake time when you try to initiate sleep. Most everyone has experienced some form of insomnia. However, it becomes more frequent within your normal. If it becomes more frequent within your normal sleep cycle, then you may want to consult your physician. Narcolepsy usually begins between the ages of 15 and 25, but it can become apparent at any age. In many cases, narcolepsy is undiagnosed and therefore untreated. Narcolepsy is excessive daytime sleepiness and can be very dangerous. You may remember in 2013, a driver of a New York commuter train that derailed at high speed, killing 4 people, had a serious case of narcolepsy. This is one of many accidents that is caused because of some type of sleep disorder. Many of the accidents never get reported on the actual case. Restless leg disorder is related to sensation to movement. Some patients describe it as a creepy, crawly feeling in their legs. It most frequently happens when a person is tired. It's an uncontrolled sensation to want to move your legs. If they continue while you are sleeping, it's called PLMS, which stands for periodic leg movements. This can cause you to stay in a lighter sleep and prevent you from going into a deeper sleep or even REM sleep. Some people describe it kind of as an octopus. So, okay, sleep is healing. Sleep is an essential part of healing. The less sleep you get, the weaker your immune system gets, and sometimes it leaves it less able to fight off colds, flu, and other infections. And studies have even found that being sleep deprived can also affect the response to vaccines. I know this is kind of a cloudy slide, but sleep is an essential part of healing. The less sleep you get, the weaker your immune system gets. So leaving it less able to fight off colds, flu, and other infections. Treating sleep apnea patients while in the hospital. For effective treatment, OSA patients must use their CPAPs anytime while sleeping. When hospitalized, many patients leave their CPAPs at home, trusting that physicians and nurses will know how to manage their OSA, or obstructive sleep apnea. However, they often find out that hospital staff are not aware that the patient has OSA, or that hospitals are not prepared to care for OSA. Inadequate care of OSA while hospitalized can, among other things, impair healing, worsen pain, increase blood pressure, all leading to longer hospital stays and delayed recovery. Additionally, the use of narcotic pain medications and the lingering after effects of anesthesia can also make obstructive sleep apnea worse. Sleep apnea and same-day surgery. It is well known that sleep apnea can be a complicating factor in administering anesthesia. It's also known when the anesthesiologist is aware of the sleep apnea of the patient undergoing surgery and takes appropriate measures to maintain the airway, the risk of administering anesthesia to people with sleep apnea can be minimized. Sleep apnea and same-day surgery. Why is it so dangerous? General anesthesia suppresses your upper airway muscle activity, and it may impair breathing by allowing the airway to close. Anesthesia thus may increase the number and duration of sleep apnea episodes and may decrease atrial oxygen saturations. Normally, when someone has sleep apnea, they have little wake periods throughout the night. They are not breathing well, so an impulse goes to the brain, causing the person to move or arouse from their sleep to breathe. So anesthesia inhibits arousals that would occur during sleep. So how can we assess patients? Simply by asking the question, are they currently on CPAP? Do they snore nightly? Has anyone ever said that they stopped breathing in their sleep? Do you feel groggy upon awakening? Do you fall asleep during the day? Do you frequently have headaches in the morning? Just some of the basic questions about if a patient is on CPAP or BiPAP. It's really interesting because in the sleep lab, we also see people that have come into the sleep lab, and if I ask them why they're there, a lot of times they'll say, well, I had surgery, and anesthesiologist or nurse saw them stop breathing, so they thought, well, maybe I need to go see my doctor and have a sleep study done. So then they come over to see us. But we're seeing more and more of that as we go. Okay. The Baptist Easley top 10 sleep steps to better sleep. We actually have 7. So we've kind of cut it down a little bit here. Stick to a sleep schedule. Go to bed and wake up the same time every day, even on weekends, holidays, and days off. Being consistent reinforces your body's sleep-wake cycle and helps to promote better sleep at night. Pay attention to what you eat and drink. Don't go to bed either hungry or stuffed. Your discomfort might keep you up. And of course, nicotine, caffeine, and alcohol deserve caution too. The stimulating effects of nicotine and caffeine take hours to wear off and can wreak havoc on quality sleep. Creating a bedtime ritual. Do the same things every night to tell your body it's time to wind down. This might include taking a warm bath or shower, reading a book, or listening to soothing music, preferably with the light dimmed. Try to keep electronic devices away from the bedroom. You'd be surprised how many people that come in for a sleep test bring iPads and cell phones all night. And they wonder why they're not getting a good night's sleep. So it is important. Get comfortable. Create a room that's ideal for sleeping. This means cool, dark, and quiet usually. Consider using room darkening shades, earplugs, a fan, or other devices to create an environment that suits your needs. Limit your daytime naps. Long daytime naps can interfere with your nighttime sleep, especially if you're struggling with insomnia or poor sleep quality at night. Regular physical activity can actually promote better sleep, helping you to fall asleep faster and to enjoy a deeper sleep. But the timing is important. If you exercise too close to bedtime, you might be energized not to fall asleep. So if this seems to be an issue, then you need to exercise earlier in the day. But it does help you actually get better sleep. Manage stress. That's easier said than done, right? But sometimes relaxation actually can help before bedtime. A lot of times our mind wants to keep on going after we lay down to go to bed. But remember that no matter what you're stressing about, you cannot solve the problem laying there in bed. It's still going to be there in the morning. So you might as well put your mind at rest and try to get a good night's rest. Okay, now we're going to do a little test here. See if you all pass. Not really. Hopefully you've added up your total numbers there on your sheets, on your Epworth. So we're going to go over kind of what that means. What is your total? Okay, 1 to 6, congratulations, you're getting enough sleep. 7 to 8, you score average. 9 and up, you probably need to have a sleep test done to see kind of what's going on with your sleep. So that kind of gives you an idea. There's no pass or fail, so. And that is it.